On this section, we're going to talk about hospitalization, something I hope that you all don't have to experience. And here to help me do that is my partner at Family Practice Associates, Dr. Joe Gerhardstein. Welcome.
Thanks, Jeff.
All right, now this time of year, it's winter, it's starting to get a little cold, and we're starting to see a little bit, at least in my experience, a little increase in hospitalization, mainly because of infections. But what are some common things that people end up in the hospital for?
Well, as you just mentioned, this time of year we're seeing a lot of flu, and then the flu winds up coming into pneumonia. Sometimes we can treat that on an outpatient basis if the patients are stable. Sometimes they need to be put in the hospital for these problems.
It's not like when you go in the hospital like it used to be. When we were a lot younger, we would round at several hospitals. We'd take care of the patients in the morning. We'd go to the office in the afternoon, go back to the hospital. Now they've got something called a hospitalist. Tell me about that.
Well, as you know, around the turn of the century when we were younger, we used to go to the hospital. And now most primary care physicians use a hospitalist. So if the patient leaves my office and they need to go to the hospital, more than likely they're going to be managed by a hospitalist. And that's a doctor who just takes care of patients in the hospital. They don't really see them outside of the hospital. And that hospitalist will then say, well, you need a pulmonologist or a cardiologist or a nephrologist or whatever kind of ologist that they need, and they'll manage them while they're there in the hospital.
And the advantages to that, they tell us they lower the length of stay. They're there in the hospital, can take care of things a lot quicker.
Well, when you and I did this years ago, we go in to see a patient in the morning. Sometimes we come back at the end of the day, but if something happens during the day when we're in office, it could be a problem. So the hospitalist is there throughout the day.
Now, it also used to be, again, even before we were practicing, when somebody would get a cold, they may end up in the hospital. Right now, you've got to be really sick to be in the hospital.
Well, unfortunately, when you go in the hospital, you can come in with one problem and then develop more problems. Who's in the hospital? People who are really sick, people who have lots of germs. We use all kinds of techniques as far as hand washing, whatever we can do to prevent transmission of any kind of infections. You know, we try to, if somebody has to go to the hospital, we try to transfer all the information of what kind of allergies a patient has, what kind of medicines that they have. And those hospitalists take that information and try to do the best they can with the patients.
Now, sometimes you just can't avoid it. You know, you end up in the hospital, which is when you're really sick, you need to be there. But when you get better and you come back, then you're an appointment in our office, which we call a TCM, or Transition of Care Management. And that's kind of a follow-up to the hospital. Tell me what happens at that type of visit.
Well, when you're really sick and in the hospital and then you find you're getting ready to go home, they give you this book, okay, a multi-page book, and they talk about all the things that happen in the hospital, the medications you take, and it's confusing. And I've read some of these booklets as well, and I can understand why a lot of patients get frustrated. So usually within a couple days of being in the hospital, you get a phone call from your primary care physician saying, hey, I understand you're in the hospital. They sent you on some medications. What are those medications? Make sure that the patient got the prescriptions that they needed. And then we like to see them back and follow up soon, within a week or 2 weeks after they've been in the hospital, to make sure they know what happened in the hospital, make sure they got their medications. Sometimes they come back and they say, Joe, what was wrong with me? What did they do to me?
Yeah, unfortunately, that's a pretty common question. And one of the questions that I get that you might want to address is medications. Sometimes I ask them to even bring them with their medications because it's very confusing at times.
Well, it's confusing. They may have some certain medicines while they're at home, and those are all on the insurance list of approved medications. When they get to the hospital, the hospitalist may have to change those because the hospital's got their own formulary, which might not agree. And then when they go back home again, they're confused. Do I need to take the first medicines or the second medicines?
And this TCM visit can help clarify all that.
Precisely, Jeff.
All right, briefly, is there things you can do to try to prevent hospitalization?
Well, one of the things we talk about is the flu and the pneumonia, so get your flu shot, get your pneumonia shot. We actually have 2 different pneumonia shots that we're marketing right now. pneumonia 23 and a pneumonia 13, and if you're 65 or older, you should get one of each of those. So try to prevent you from getting infection. A lot of COPDers, people with lung problems, get infections this time of year. If you get sick, you probably need to get into your primary care doctor early and not wait till you get too sick.
And see your doctor, routine care to keep yourself healthy.
Yes.
Great information. Thanks for coming in. Hope that avoids a hospitalization for you.